Okay. This is my first vlog for reviewing the first few weeks our of our class. So I'll be reviewing the course materials from weeks 1 through 3, reflecting on what I found surprising or interesting, how to plan to use this information, and how I hope to carry this on in my future as a public health official. Um, so. I really felt like this was kind of the building blocks for what was going to be going into the course and kind of I needed this to formulate and shape how I was going to view the course as an entire thing, as a whole, essentially. Um, so I thought this was a good building block, and there were a few of the readings that I'm going to review, as well as some of the videos that I'll review as well, and how those kind of impacted me and kind of my forward thinking of what the course would entail and how this would influence some of my ideas and how I would reflect and view the course going forward. One concept that I looked at in the Alan Goodman's reading about why genes don't really count um, was the idea that race is not a biological reality within this, but it's actually a social contract and a social construct, actually. Um, it was interesting to me because it's a persistent idea that is truly outdated when facing racial differences that are rooted in biology. Um, he went on to explain that race isn't biological, but it still has biological consequences because of how society treats racial groups differently. So that was something that I really kind of took away from that and kind of incorporated into one of the cornerstones of what I thought the course might be. The next review I wanted to give was about the video from PBS based on what was called "What is Race." It added a little bit more into what Goodman was saying, showing that humans are more genetically alike than different, and it really emphasized that even though physical traits are different. They don't specifically separate people by categories. So, kind of combining those two were understanding what the idea of race, what biological separations kind of might influence healthcare and healthcare inequities and things like that. Um, another one of the readings that I really focused on was the Burton Clayton's unequal treatment piece. That really kind of divulged, or I don't want to say divulged, really dove into the idea of race and how that plays a part into policies and how, races were segregated even within hospitals and insurance practices influence different racial groups and really laid the foundations for the inequities that we see currently that are going on. Um, being a undergraduate history major, I really focused on this as kind of a focus in what historical consequences focus within this course and how they still exist within the modern era and how these racial disparities are visible within the communities that we kind of look at as well within a public healthcare spectrum. Um, and then the last one that I really wanted to touch on was by Ichiro Kirakawa Kawachi's, butchering that name. But his focus on how race and class are co-determinants of health disparities kind of built on that as well, kind of like I'd done with the previous two examples, and how he argued that racial disparities can't be fully understood without explaining and understanding economic and social stratifications. So what this really laid the base work for me is this really is going to be a layered conversation when trying to understand disparities within this coursework and how we're going to have to frame everything. So, quickly, just kind of wrapping up here in the last couple of minutes, how can I use this information? As I mentioned, it's a groundwork, it's a cornerstone, it's understanding what the layers of this course might entail from these different readings, and there were other ones that also have influence, but these were the ones that I took away from the first 3 weeks that really kind of laid a very s- uh, stable ground, I guess a cornerstone. I've used it a couple of times into what we're actually going to be discussing and what the issues actually entail and how to look at those from different angles and even peeling back the different layers that involve these as well. Um, what do I want to remember within or in 5 years from this course, from these, and how this will influence me in 5 years? Just understanding that it isn't as clear as some people try to make it out to be, that there are different layers that go into the inequities within these communities and within these certain groups that others might not think influence health, but they really do have a cornerstone within those communities and within those groups that are unfortunately historically they don't have the same equity that everyone else does. And that kind of falls back into how I can influence and what I want to do as a public health care worker as well. So this is just a quick recap of the first 3 weeks of the course, kind of laying the groundwork for how the course is going to be viewed, how it'll be influenced, and just how my ideas and thinking process will go through based on these, 4 small examples from the readings and the videos, and then some of the discussions we've had in class, and how we are going to go forward, and how this can actually start to become a more broad spectrum of how inequities exist within this course.